Government is budgeting to invest $54.5 billion in the health of the Jamaican population in the 2016-2017 fiscal year. The bulk of the Health Ministry's budget is earmarked to take care of housekeeping or recurring expenses. That includes things like paying employees and ensuring that government's network of 23 hospitals and over 336 health centers and specialized institutions have what they need to service the population. As it works towards improving Jamaica's health profile, the responsible ministry has set aside just over $28 million to fund capital projects this year, supplemented by approximately $1.3 billion to be earned from the National Health Fund. Most of that is earmarked for the Health Services Improvement Project. Under that project, government intends to procure a hospital management information system designed for polyclinics, provide vector control support, rehabilitate healthcare facilities, and acquire a linear accelerator for cancer treatment. Another $24 million will be spent to improve the water supply at the Bellevue Hospital. Government is also getting $1.5 billion in budgetary support from its multilateral and bilateral partners this year. $361.58 million is earmarked for a project aimed at promoting safer sex practices among groups at high risk for HIV transmission. It's funded jointly by the Government of Jamaica and the United States Agency for International Development. Among this year's targets are finalizing and disseminating the National HIV/AIDS Workplace Policy and providing clinical assessment of and antiretroviral treatment for HIV-positive adults and children. Another initiative, the National HIV/AIDS Response Project, will receive $624 million in support from the Global Fund. Its goal is to reduce AIDS-related morbidity and mortality through biomedical and supporting interventions. The European Union will also continue its funding of the Health Ministry's program for the reduction of maternal and child mortality. This year, PROMAC is getting $501 million to continue work on neonatal high-dependency units, including the provision of equipment. The money will also support continued training for doctors and nurses for the neonatal units, among other things. Another significant capital project being implemented this fiscal year is the Institutional Strengthening to Improve National Surveillance, Prevention and Control of Infectious Disease project. $28.75 million is earmarked to, among other things, finance a national preparedness plan and roadmap for the potential threat of the Ebola virus. And under Project Inner City, $4.3 million will be spent to address drug abuse through public education. Those are some of the ways the Ministry of Health will be attending the health needs of the nation this fiscal year, safeguarding the health of the people and the wealth of Jamaica.